My name is Andrew Wolfe. I'm a board-certified plastic surgeon in Denver, Colorado, focusing on cosmetic plastic surgery. One of the more popular procedures we do is gynecomastia. And gynecomastia is simply enlargement of the male breast. Men have breast gland just like women do. It tends to be smaller, but in a significant number of gentlemen, we see enlargement of the breast. It can happen in a variety of different settings. Very commonly, you'll have a younger man who, at the age of puberty, will, because of hormonal changes in the body, develop breast gland. Many of those men will see that gland resorb over time as their hormones get sorted out, but very commonly they don't. And so it's not uncommon to see somebody who's 18, 20, 25 years old who's had some swelling in one or both of their breasts since puberty, and it can be really challenging, especially if you've got someone who's lean and fit, and this is Colorado. We have a lot of very, very fit, very active people, and so if you've got significant enlargement of the breast gland, it can make men very uncomfortable taking their shirts off, doing outdoor activities, playing sports. If it's a significant enough enlargement, even in clothing, it can really feminize the appearance of the chest. And so that's a very common scenario, is where somebody develops gynecomastia during puberty and it never goes away. I will see other gentlemen who, maybe because of some weight challenges, develop more tissue later in life. That can be a combination of fat and breast gland, which is fairly straightforward to treat. And then I have a lot of patients who are in the bodybuilding industry. And some of these men will take supplements or other medications that can cause enlargement of the breast gland. And so that is something that requires surgery to correct. Whether it is puberty associated, bodybuilding, or somebody who's got excess tissue just naturally based on their genetics, the treatment tends to be fairly similar. The goal is to go in, remove that extra tissue, and masculinize the chest. We need to leave a thin layer of breast gland attached to the undersurface of the nipple to maintain shape and blood supply to the nipple, but everything else really can come out. And so in some of these gentlemen, especially the thinner guys or the bodybuilders, it's really just a surgical excision of the gland, and that is an incision limited to the bottom third of the areola of the nipple itself. It's an incision which gives plenty of access to do anything I need to do within the breast. And so you can go in, leave that required tissue, remove everything else, and get a very, very significant improvement in the shape of the entire chest. If somebody's got excess fat in the area as well, not uncommonly, I will do liposuction over the whole chest, and that can be that prepectoral area. It can also be out under the arm and the lateral chest. So we'll do liposuction over that whole area, and then go in surgically with a small incision around the nipple and remove the breast gland at the same time, because although liposuction is very effective for fat, the breast gland is a very firm, rubbery tissue, and it doesn't come out very well with liposuction. So usually you'll need to excise it. It's a procedure which has a very, very high satisfaction rate, because you've got guys who've been self-conscious about something for a long, long time, and you can come in one fell swoop and correct their chest contour, and they can just get on with their lives, and they don't want to deal with it anymore. And so it's typically a 2.5 hour surgery. Recovery is typically fairly mild. You're sore for a couple of days, but most people are back to work in 3-4 days, back to the gym in 2 weeks, and essentially doing everything at 6. And at that point, they can just get on with their lives.